Welcome to Medical Terminology, Chapter 3 to 5 Practice Questions. There are 100 multiple choice questions in this video. Ready? Before you forget, please click like and subscribe. Question 1. Cholangitis is inflammation, itis, of the what? Cholangio. A. Salivary glands. B. Gallbladder. C. Bile vessel. D. Liver. The answer is C. Bile vessel. The term choledochal means pertaining to L. the what? Choledoch/O. A. Bile vessels. B. Cheek. C. Common bile duct. D. Gallbladder. The answer is C. Common bile duct. Colonoscopy is the visual examination scopy, of the what? Kerno? A. Large intestine. B. Small intestine. C. Rectum. D. Anus. The answer is A. Large intestine. The correct plural form of the term thrombus: A. Thrombus. B. Thrombi. C. Thrombuses. D. Thrombi. The answer is B. Thrombi. The term bradycardia means A. Slow breathing. B. Slow heartbeat. C. Painful swallowing. D. Fast heartbeat. The answer is B. Slow heartbeat. Excessive or increased blood sugar, a sign of diabetes mellitus: A. Hyperglycemia. B. Hypoglycemia. C. Hyperplasia. D. Hypertrophy. The answer is A. Hyperglycemia. Artificial limb or part of the body: A. Syndactyly. B. Prodrome. C. Prosthesis. D. Symphysis. The answer is C. Prosthesis. An example of a congenital anomaly: A. Hemiglossectomy. B. Prosthesis. C. Malaise. D. Syndactyly. The answer is D. Syndactyly. The term buccal means pertaining to L. the what? Bucco. A. Palate. B. Lips. C. Cheek. D. Abdomen. The answer is C. Cheek. A gastrostomy is a new opening, stomy, of the what? Gastro, to the outside of the body. A. Small intestines. B. Ileum. C. Colon. D. Stomach. The answer is D. Stomach. Gluconeogenesis is the formation genesis of new, neo, of what? Gluco. A. Saliva. B. Fat. C. Protein. D. Glucose, sugar. The answer is D. Glucose, sugar. The prefix dis means A. Bad, painful. B. Before. C. Above, upper. D. Beyond, change. The answer is A. Bad, painful. The prefix supra means A. New. B. Above, upper. C. Bad, painful. D. Before. The answer is B. Above, upper. The term that means disappearance of symptoms of the disease: A. Relapse. B. Metastasis. C. Remission. D. Prolapse. The answer is C. Remission. The prefix sin means A. Together with. B. Between. C. Against. D. Within. The answer is A. Together with. The term labiodental means pertaining to L. the what? Labio, and teeth, dent/O. A. Cheeks. B. Gums. C. Lips. D. Tongue. The answer is C. Lips. Cholecystolithiasis is the abnormal condition, iasis, of stones, lith/O, in the cholecysto. A. Gallbladder. B. Bile vessels. C. Liver. D. Common bile duct. The answer is A. Gallbladder. A sialadinectomy is the removal, ectomy, of a what? Sialadino. A. Salivary gland. B. Cheek. C. Tooth. D. Tongue. The answer is A. Salivary gland. Aphthous stomatitis is inflammation, itis, of the what? Stomato, with small ulcers. A. Mouth. B. Cheek. C. Gums. D. Tongue. The answer is A. Mouth. Glands that lie on top of each kidney. A. Mammary glands. B. Parathyroid glands. C. Pancreas. D. Adrenal glands. The answer is D. Adrenal glands. The prefix neo means A. Slow. B. New. C. Above, upper. D. Complete, through. The answer is B. New. The prefix that means under, deficient. A. Dia. B. Ana. C. Hypo. D. Hyper. The answer is C. Hypo. Pertaining to the opposite side. A. Retroperitoneal. B. Contralateral. C. Lateral. D. Contraindication. The answer is B. Contralateral. A glossectomy is the removal, ectomy, of the what? Glosso? A. Gums. B. Cheek. C. Tongue. D. Mouth. The answer is C. Tongue. The prefix that means change. A. Hypo. B. Sin. C. Hyper. D. Meta. The answer is D. Meta. LFTs are tests for the presence of enzymes and what in the blood? A. Protein. B. Bilirubin. C. Blood. D. Sodium. The answer is B. Bilirubin. A hemoccult test is a test used to detect what in feces? A. Blood. B. Sodium. C. Bilirubin. D. Protein. The answer is A. Blood. A gastric bypass is also known as a what? A. Cholangiography. B. Gastrojejunostomy. C. Laparoscopy. D. Paracentesis. The answer is B. Gastrojejunostomy. A laparoscopy is a visual exam of what using a laparoscope? A. Abdomen. B. Throat. C. Chest. D. Rectum. The answer is A. Abdomen. Nasogastric intubation is the insertion of a tube through the nose into the what? A. Liver. B. Large intestine. C. Stomach. D. Small intestine. The answer is C. Stomach. The prefix that means after, behind. A. Post. B. Mull. C. Brady. D. Per. The answer is A. Post. Identify the combining form that means fingers or toes. A. Furco. B. Dactylo. C. Cutaneo. D. Thello. The answer is B. Dactylo. Identify the combining form that means tongue. A. Carpo. B. Glosso. C. Thello. D. Theo. The answer is B. Glosso. The prefix that means within. A. Ana. B. Neo. C. Post. D. Endo. The answer is D. Endo. The term that means bending forward. A. Antibiotic. B. Anteflexion. C. Antisepsis. D. Bilateral. The answer is B. Anteflexion. Normal splitting into two branches such as the trachea splits to form the bronchi. A. Bilateral. B. Diameter. C. Bifurcation. D. Hypertrophy. The answer is C. Bifurcation. Identify the combining form that means nipple. A. Thello. B. Topo. C. Thyro. D. Theo. The answer is A. Thello. Identify the combining form that means skin. A. Sepso. B. Cutaneo. C. Naughty. D. Ciso. The answer is B. Cutaneo. A substance produced in response to a poison. A. Antitoxin. B. Antisepsis. C. Antikebum. D. Anteflexion. The answer is A. Antitoxin. A feeling of well-being. High. A. Euthyroid. B. Euphoria. C. Dysplasia. D. Dyspnea. The answer is B. Euphoria. The term that means before birth: A. Postpartum. B. Antisepsis. C. Antechebum. D. Antepartum. The answer is D. Antepartum. The term that means pertaining to one side: A. Bilateral. B. Unilateral. C. Contralateral. D. Paralysis. The answer is B. Unilateral. Signs and symptoms that precede an illness: A. Prodrome. B. Prognosis. C. Diagnosis. D. Syndrome. The answer is A. Prodrome. The term that means painful breathing: A. Dyspnea. B. Apnea. C. Dysentery. D. Dysplasia. The answer is A. Dyspnea. The term that means pertaining to between the ribs: A. Intravenous. B. Antisepsis. C. Contralateral. D. Intercostal. The answer is D. Intercostal. The term that means the condition of low or decreased blood sugar: A. Hyperplasia. B. Hypodermic. C. Hypoglycemia. D. Hyperglycemia. The answer is C. Hypoglycemia. The tube connecting the throat to the stomach: A. Eglottis. B. Trachea. C. Esophagus. D. Ileum. The answer is C. Esophagus. The combining form that means sugar: A. Lipo. B. Stato. C. Gluco. D. Pio. The answer is C. Gluco. The combining form bil/O means the same as A. Colorado. B. Amilo. C. Chilo. D. Choli. The answer is D. Choli. The combining form that means throat: A. Esophago. B. Pharyngo. C. Glosso. D. Palato. The answer is B. Pharyngo. The combining form cholecysto means A. Lip. B. Abdomen. C. Gallbladder. D. Common bile duct. The answer is C. Gallbladder. Which of the following does not mean fat? A. Stato. B. Lipo. C. Adipo. D. Bilo. The answer is D. Bilo. Bilo means bile. Bile is not fat. It's a substance released by the liver that helps break up fat. The term that means pertaining to the abdomen: A. Gastric. B. Celiac. C. Colonic. D. Pelvic. The answer is B. Celiac. The combining form meaning third part of the small intestine: A. Jejunal. B. Duodenal. C. Colorado. D. Ilio. The answer is D. Ilio. The term that means chewing: A. Anabolism. B. Deglutition. C. Mastication. D. Peristalsis. The answer is C. Mastication. The combining form gingivo means A. Gums. B. Tooth. C. Tongue. D. Stomach. The answer is A. Gums. The soft tissue within a tooth: A. Pulp. B. Dentin. C. Enamel. D. Uvula. The answer is A. Pulp. The small sac under the liver stores bile: A. Cecum. B. Gallbladder. C. Pancreas. D. Jejunum. The answer is B. Gallbladder. The first part of the small intestine: A. Anus. B. Colon. C. Ileum. D. Duodenum. The answer is D. Duodenum. The hormone produced by the pancreas: A. Lipase. B. Bile. C. Insulin. D. Bile. The answer is C. Insulin. The term that means pertaining to the throat: A. Pharyngeal. B. Esophageal. C. perianal. D. Duodenal. The answer is A. Pharyngeal. The term that means enlargement of the liver: A. Hepatoma. B. Splenomegaly. C. Hepatitis. D. Hepatomegaly. The answer is D. Hepatomegaly. The term that means pertaining to under the tongue: A. Submandibular. B. Sublingual. C. Postprandial. D. Gingivitis. The answer is B. Sublingual. Identify the prefix that means no, not, without. A. Kata. B. Anti.
C. Aor, Indiana. The answer is C. Aor, an.
Identify the prefix that means against. A. Anti. B. Con. C. Thigh. D. Kata. The answer is A. Anti. Through, complete. A. Pro. B. Ana. C. Endo. D. Dia. The answer is D. Dia. The term that means disease condition of the small intestine: A. Cardiomyopathy. B. Colitis. C. Enteropathy. D. Parenteral. The answer is C. Enteropathy. The specialist who performs root canal therapy: A. Orthodontist. B. Pedodontist. C. Endodontist. D. Periodontist. The answer is C. Endodontist. The term triglycerides means: A. Microscopic projections. B. Ridges on the hard palate. C. Small elevations on the tongue. D. Large fat molecules. The answer is D. Large fat molecules. The term cholecystectomy means: A. Removal of gallbladder. B. Incision of common bile duct. C. New opening of the colon. D. Removal of urinary bladder. The answer is A. Removal of gallbladder. The term that means visual examination of the large intestine: A. Colostomy. B. Laparoscopy. C. Colonoscopy. D. Cholecystectomy. The answer is C. Colonoscopy. The term that means abnormal accumulation of fluid in the abdomen: A. Jaundice. B. Ascites. C. Anorexia. D. Melena. The answer is B. Ascites. The term that means fat in the feces: A. Melena. B. Irritation. C. Steatorrhea. D. Ascites. The answer is C. Steatorrhea. The term that means gas expelled through the anus: A. Irritation. B. Steatorrhea. C. Diarrhea. D. Flatus. The answer is D. Flatus. The term that means muscle pain: A. Arthralgia. B. Myoma. C. Myalgia. D. Localgia. The answer is C. Myalgia. The suffix emia means: A. Blood condition. B. Treatment. C. Tumor. D. Flow. The answer is A. Blood condition. The term that means excessive development: A. Erythropenia. B. Achondroplasia. C. Atrophy. D. Hypertrophy. The answer is D. Hypertrophy. The suffix ptosis means: A. Cell. B. Prolapse. C. Treatment. D. Hernia. The answer is B. Prolapse. The suffix scope means: A. Record. B. Cell. C. Surgical repair. D. Instrument to visually examine. The answer is D. Instrument to visually examine. The term that means fear of heights: A. Agoraphobia. B. Acrophobia. C. Arthralgia. D. Chondromalacia. The answer is B. Acrophobia. The suffix therapy means: A. Deficiency. B. Pain. C. Treatment. D. Hernia. The answer is C. Treatment. The suffix tomi means a. Incision, cutting into, b. Hardening, c. Process of viewing, d. Controlling, stopping. The answer is a. Incision, cutting into. The term that means removal of the voice box, a. Mastectomy, b. Laryngectomy, c. Laryngeal, d. Nephrectomy. The answer is b. Laryngectomy. The meaning of the combining form axil/o, a. Blood vessel, b. Abdomen, c. Armpit, d. Tonsils. The answer is c. Armpit. The term that means destruction of blood cells, breakdown of red blood cells, a. Hemolysis, b. Hemostasis, c. Hydronephrosis, d. Hematoma. The answer is a. Hemolysis. The meaning of the combining form angi/o, a. Abdomen, b. Pain, c. Tonsils, d. Blood vessel. The answer is d. Blood vessel. The term that means blood is held back from an area, a. Ischemia, b. Thrombocyte, c. Hematoma, d. Anemia. The combining form that means muscle, a. Morpho, b. Myelo, c. Myo, d. Anjo. The answer is c. Myo. The term that means enlargement of the spleen, a. Splenomegaly, b. Osteomalacia, c. Acromegaly, d. Epigastric. The answer is a. Splenomegaly. The combining form that means tonsils, a. Pulmono, b. Inguino, c. Morpho, d. Tonsilo. The answer is d. Tonsilo. The term that means deficiency of red blood cells, a. Thrombocytopenia, b. Erythropenia, c. Neutropenia, d. Erythrocyte. The answer is b. Erythropenia. The combining form that means lungs, a. Morpho, b. Myo, c. Bio, d. Pulmono. The answer is d. Pulmono. The term that means inflammation of the spinal cord, a. Myelitis, b. Myoma, c. Gastritis, d. Encephalitis. The answer is a. Myelitis. The term that means a clotting cell, platelet, a. Thrombocyte, b. Leukocyte, c. Erythrocyte, d. Basophil. The answer is a. Thrombocyte. The term that means a red blood cell, a. Erythrocyte, b. Leukocyte, c. Lymphocyte, d. Thrombocyte. The answer is a. Erythrocyte. Blood cell that produces antibodies, a. Thrombocyte, b. Lymphocyte, c. Erythrocyte, d. Platelet. The answer is b. Lymphocyte. The term that means tumor of muscle, a. Cystocele, b. Encephalitis, c. Myelitis, d. Myoma. The answer is d. Myoma. The term that means puncture to remove fluid from the sac around the embryo, a. Amniocentesis, b. Thoracentesis, c. Abdominocentesis, d. Laparotomy. The answer is a. Amniocentesis. Dentalgia is pain, algia, in a what denti? A. Lip, b. Cheek, c. Tooth, d. Tonsil. The answer is c. Tooth. Thank you for watching. Please like, subscribe, comment, and share.